Bismillahirrahmanirrahim. Today lecture is related with headache, and in medical terminology headache is called cephalgia. Headache or cephalgia, it is a condition of pain in the head and neck, or upper back pain may also be interpreted as headache. Headache are a type of pain referred to the surface of the head from deep head structures. Some headache result from pain stimuli arising inside the cranium, but other result from pain arising outside the cranium, such as from nasal sinuses. It ranks among the most common local pain complaints. Majority of headaches are benign and self-limiting. What causes a headache anyway? It's not just loud music or a tight deadline or even an impending visit from your mother-in-law. With so much going on, it can be hard to avoid headache, but there are a few common and unexpected things you can learn to prevent pain in future. Headaches are a very common condition that most people experience many times during their lives. They are the most common form of pain and are a major reason cited for days missed at work or school, as well as increase in number of visits to the healthcare provider. What are types of headache? There are more than 150 types of headache. They fall into two main categories: primary headache and secondary headaches. Common causes are tension, migraine, eye strain, dehydration, sinusitis. Much rare are headache due to life-threatening conditions such as meningitis, encephalitis. Meningitis means inflammation of the meninges, and encephalitis means inflammation of the brain tissue. Cerebral aneurysm and brain tumor. When the headache occurs in conjugation with a head injury, the cause is usually quite evident. Pain-sensitive area in the cranial wall. The brain tissue themselves are almost totally insensitive to pain, even cutting or electrically stimulating. Tugging on the venous sinuses around the brain or stretching the dura at the base of the brain can cause intense pain that is recognized as headache. Also, any type of traumatizing, crushing, or stretching stimulus to the blood vessel of the meninges can cause headache. Especially sensitive structure is the middle meningeal artery. Area of refer headache. Stimulation of pain receptor in the cerebral wall above the tentorium include the upper surface of the tentorium itself, initiate pain impulse in the fifth cranial nerve and cause refer headache to front half of the head in surface area supplied by this nerve. Pain impulses from beneath the tentorium enter the central nervous system through the glossopharyngeal, vagal, and second cranial nerve, which also supply the scalp above, behind, and slightly below the ear. Subtentorial pain stimuli cause occipital headache. Refer to the posterior part of the head. This is the tentorium which cover the cerebellum and separate the cerebellum from the cerebral cortex. In this picture you can see this is the tentorium. The headache arises from its various surfaces radiate to various area in the head. This is a magnifying picture of the tentorium cerebri which cover the cerebellum, and this is falx cerebri which cover the cerebral cortex. Primary headache. Primary headache, migraine, tension type of headache, trigeminal, autonomic, cephalgia, TAC, exertional and other headache, a grave bag of other headaches. Secondary headaches. Secondary headaches include post-traumatic headache, vascular disease, abnormal intracranial pressure, neoplasm, and hydrocephalus. Substance abuse, CNS infection, central nervous system infection, and metabolic disorders, cervigenic, eye, sinuses, and jaw. Abnormality of the cervical spine, abnormality in the eye and sinuses and in the jaw also cause headache. Psychiatric headache due to psychiatric problems and neuralgia. Types. There are 5 types of headache: vascular headache, myogenic or muscle tension, cervicogenic, traction, inflammatory. Muscular myogenic headache appear to involve the tightening or tensing of facial and neck muscle. They may radiate to the forehead. Tension headache is the most common form of myogenic headache. Migraine or severe headache prevalence in U.S. adult population. Prevalence estimate from several U.S. governments survey from 1997 to 2015. It includes that females ratio is 20.7% and male ratio is 9.7%. Overall prevalence of headache is 15.3% and more than 65-year-old have the prevalence of 5.1%. Migraine criteria. Migraine without aura. When no aura is present in this type of migraine, at least 5 attacks fulfilling criteria B and C. B criteria is headache attack lasting 4 to 72 hours untreated or unsuccessfully treated. And C criteria is during headache have at least one symptoms or sign: nausea or vomiting, photophobia not attributed to another disease. There may be no other disease related with the headache. Headache with at least 2 symptoms: unilateral location, pulsating quality, moderate to severe intensity, aggravated by or avoid routine physical activity, walking, climbing stairs. Chronic migraine. Headache more than 15 days per month for more than 3 months. Most of headache fulfill criteria for migraine more than 8 days per month. Head pain anatomy. Fifth nerve, ophthalmic division mostly, large cerebral arteries, large venous sinuses, dura mater, aya mater, neurotransmitter, trigeminal ganglia, and calcitonin gene related peptide. So these are the structure which cause headache. When abnormality in these structures occur, they cause headache. And substance P. Specific type of headache include tension headache, migraine, brain freeze, also known as ice cream headache, thunderclap headache, toxic headache, coital cephalgia, also known as sex headache, sinus headache, rebound headache, also called medication overuse headache, abbreviated MOH, red wine headache. Like other type of pain, headache can serve as warning signal or more serious disorder. This is particularly true for headache caused by inflammation, include those related to meningitis. What is a migraine headache? A migraine headache is a severe pain felt on one and sometimes both sides of the head. The pain is mostly in front, around the temple, or behind one eye or ear. Besides pain, there is nausea and vomiting, and be very sensitive to light and sound. Migraine can occur many times of the day. Though it's often start in the morning, the pain can last a few hours or up to 1 or 2 days. Causes of migraine headache are not known, but some things are more common in people who have them. Age of 15 and 55. Migraine is more common in this age group, 15 to 55. Family history of migraine, they are more common in women. Classic migraine. With a classic migraine, a person has these visual symptoms, also called an aura. 10 to 30 minutes before the attack, see flashing lights or zigzag lines, has blind spot or lose vision for a short time. The aura can include seeing or hearing strange things. It can even disturb the sense of smell, taste, or touch. Women have this form of migraine less often than men. Common migraine. With a common migraine, a person does not have an aura but does have the other migraine symptoms such as nausea and vomiting. Causes of migraine. One cause of migraine is the blood flow theory. Blood vessel either narrow or expanded. Narrowing can constrict blood vessel, causing problem with sight or dizziness. When the blood vessel expand, they press on nerves nearby which cause pain. Another theory focus on chemical change in brain. When chemical in the brain that send messages from one cell to another, including the messages to blood vessel to get narrow or expand or interrupted, migraine can occur. Weather change, chocolate, alcohol or nicotine. Weather change or chocolate, alcohol or nicotine also cause headache. Causes of migraine include most migraine are not caused by a single factor or event. Many women with migraine tend to have attack brought by lack of food or sleep, bright light or loud noise, hormone change during the menstrual cycle, stress and anxiety. Headache of meningitis. Most severe headache of all is that resulting from meningitis, which cause inflammation of all the meninges, including the sensitive area of the dura and the sensitive area around the venous sinuses. Such intense damage can cause extreme headache pain referred over the entire head. Menstrual cycle and migraine. More than half of women with migraine have more headaches around or during their menstrual cycle. This is often called menstrual migraine. Just before the cycle begins, level of female hormone estrogen and progesterone sharply go down. This drop in hormone may trigger a migraine because estrogen control chemical in brain that affect a woman's pain sensation. Vascular headache. The most common type of vascular headache is migraine. After migraine, the most common type of vascular headache is toxic headache produced by fever. Headache resulting from high blood pressure, which is rare. Cervicogenic headache originate from disorder of neck, including the anatomical structure innervated by the cervical root C1 and C3. Cervical headache is often precipitated by neck movement and or sustained awkward headache position. Headache caused by low cerebrospinal fluid pressure. Removing as little as 20 milliliter of fluid from the spinal canal causes intense intracranial headache. If 20 milliliter of fluid is removed, it causes severe headache. Alcoholic headache. As many people have experienced a headache, usually follow an alcoholic binge. It is most likely that alcohol, because it is toxic to tissue, directly irritate the meninges and cause the intracranial pain. Headache caused by constipation. Constipation causes headache in many people resulting from absorbed toxic products. Food sensitivities. Food and drink release neurotransmitters which can cause headache in some people. Common food triggers include aspartame, which is artificial chemical sweetener, caffeine, chocolate, alcohol, and cheese to name a few. Extracranial type of headache. Headache resulting from muscle spasm. Emotional tension often causes many of muscle of the head spastic and is one of the common cause of headache. Headache caused by eye disorder. Difficulty in focusing one's eye clearly may cause excessive contraction of the eye ciliary muscle in an attempt to gain clear vision, cause retroorbital headache. When the eye are exposed to excessive irradiation by light rays, especially ultraviolet light, looking at sun or the arc of an arc welder for even a few seconds may result in headache that lasts from 24 to 48 hours. Sinus headache. There are several paranasal sinuses including the frontal, ethmoidal, maxillary and sphenoidal sinuses. Maxillary sinusitis, which cause headache, cause pain or pressure in maxillary cheek area, for example, toothache, headache. Frontal sinusitis can cause pain or pressure in frontal sinus cavity located behind or above eye, headache. Abnormality or infection of the frontal sinusitis cause headache behind the eye or in the front of the head. Ethmoidal sinusitis can cause pain or pressure pain between or behind eye, headache. Sphenoidal sinusitis cause headache behind the eye, but most commonly the pain is referred to the vertex of the head. Tension headache. It is renamed tension type headache by the International Headache Society in 1988 are the most common type of primary headache. The pain can radiate from the neck, back, eye or other muscle group in the body. Tension type headache account for nearly 90% of all headache. Approximately 3% of population suffering from chronic tension type headache. Frequency and duration. Tension type headache can be episodic or chronic. Episodic tension type headache are defined as tension type headache occurring less than 15 days a month, whereas chronic tension headache occur 15 days or more a month or at least 6 months. Tension type headache can last from minutes to days or even months, though a typical tension headache lasts 4 to 6 hours. Causes and pathology. The exact cause of tension type headache is still unknown. It is suggested that abnormality in peripheral and central nervous system may be involved in pathology of tension type of headache. It has long been believed that they are caused by muscle tension around the head and neck and the restriction of blood flow to these areas as a result, the cause of which is often the presence of an subconscious emotional conflict and anxiety. One of the theories says that the main cause of tension type headache is teeth clenching, which cause a chronic contraction of the temporalis muscle. Pain and possible symptom. Tension type headache pain is often described as a constant pressure. The pain is frequently bilateral, which means it is present on both sides of the head at once. Tension-type headache pain is typically mild to moderate but may be severe. In contrast to migraine, the pain does not increase during exercise. Another theory is that pain may be caused by a malfunctioning pain filter which is located in brain stem. The view is that the brain misinterprets information, for example from the temporal muscle or other muscle, and interpret this signal as pain. One of the main molecules which is possibly involved is serotonin. Evidence of this theory comes from the fact that chronic tension type headache may be successfully treated with certain antidepressants such as amitriptyline. Toxic headache. A toxic headache is the least common type of vascular headache that usually comes from a fever from acute illness such as measles, mumps, pneumonia, and tonsillitis. Common hazards in our environment also cause toxic headache with exposure. These include chemical fumes, pollution, allergens, and other health hazards. A chemical factor from the outside or inside of the body can result in a toxic headache. How is the headache diagnosed? Based on performing an initial physical examination and taking a detailed history. This is the most important part of effectively diagnosing the cause of headache, as it includes the location of headache, symptom of headache, how much it hurts, how often it hurts, how long the pain persists, and whether it is constant or worsening. A detailed history also includes whether the headache affects with daily activity, whether there are any other symptoms associated with headache such as fever, how to relieve pain, a medication that is taken on a regular basis, congenital diseases, a history of accident or concussion to the head, and lifestyle. Investigation. MRI. MRI utilizes powerful magnets and radio wave to produce detailed image of the brain and its internal structure. This is non-invasive and painless procedure allow to visualize intricacies of the skull contents, enable them to identify potential cause of headache such as tumor, cancer growth, intracranial hemorrhage, stroke rupture, or blockage of cerebral artery and degenerative changes. The resulting image provides valuable information in determining the underlying source of headache. PET CT scan. PET CT scan is a sophisticated dual modality imaging technique combining nuclear medicine and X-ray imaging. It integrates the functional information obtained from positron emission tomography PET scan with the detailed anatomical structure of 3D computed tomography CT scan. This powerful combination allows clinicians to visualize structural abnormality and internal pathology, including blood vessel, tumor, and cancerous growth, which could be the underlying cause of headache. PET scan also play a crucial role in evaluating treatment outcome, assessing prognosis, and guiding treatment decision. Ultimately, enhance the effectiveness of headache management. How is headache treated? Medication prescribing Medications such as non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen, as well as migraine relieving drugs such as triptans and ergot, should be taken under the supervision of physician. Preventive medication. Prescribing headache preventive medication to those who have frequent headache in order to reduce the frequency and severity of headache. Stress management include breathing exercise, muscle relaxation, or music therapy. Avoiding headache. Avoiding headache include factors that may trigger headache such as stress, lack of sleep, and avoiding alcohol consumption. Biofeedback. Biofeedback, a therapy that involves practicing body control to achieve balance, is performed by a doctor in collaboration with hospital specialists to assess the function of vital signs including breath, pulse, body temperature, muscle tension, or brain activation. Botox injection. Now, Botox injections are also used for migraine, headache, and several shots of Botox around head and neck once every 12 weeks to dull or prevent migraine headache. Physical therapy and acupuncture is also used for the headache. Treatment option for secondary headache. Treatment option for secondary headache caused by disease or abnormality within the skull such as intracerebral hemorrhage, stroke, brain tumor, or brain cancer include medication treatment, surgery, radiation, chemotherapy, and targeted immunotherapy. How to relieve primary headache. To relieve a primary headache include the following steps. Over-the-counter pain relievers such as paracetamol and ibuprofen. Take a breath from long period of screen time or hard work. Hot or cold compresses applied to the head. Stretching, massage of the head, neck, and back. Relaxing in a low light, quiet environment. Going for a relaxed walking. Listening to music. Playing with beloved pets. What are the complications of headache? Complications of primary headache such as use of non-steroidal anti-inflammatory drug can result in abdominal pain and gastrointestinal bleeding. Headache from an overdose of painkiller may cause withdrawal if medication is stopped. Migraine headache that lasts more than 72 hours without relief, as well as migraine headache that cause a migraneous infarct or migraine-associated seizures. Complications of secondary headache frequently arise from the underlying cause of the headache, such as brain tumor or brain cancer, which is the true cause and require treatment such as medication, surgery, or chemotherapy to treat the symptom. Those suffering from chronic headache or headache complications should consult a medical professional for a thorough diagnosis and a systematic treatment plan to treat headache and complication effectively. What is the prevention of headache? Primary headache can be prevented by pinpointing the cause of the headache or factors that trigger primary headache, which vary from person to person, and changing those behavior such as getting enough sleep, not skipping meal, and drinking enough water. Limiting the amount of caffeine or alcohol consumption on a daily basis. Exercising in moderate, implementing stress reducing technique, avoiding the smell of certain perfume that may trigger headache to prevent recurrence. Thank you. Please subscribe the channel and press the bell icon for in-time notification and leave your valuable comment for the improvement of the channel.